Question number 1. What primarily determines cardiac output or CO? Stroke volume times heart rate, blood pressure times stroke volume, preload times afterload, heart rate times blood pressure. The correct answer is option A. CO equals SV times HR. Cardiac output is the volume of blood pumped per minute. Question number 2. Which factor directly increases preload? Increased venous return, increased afterload, increased heart rate, increased contractility. The correct answer is option A, increased venous return. Preload is in diastolic failing, more venous return equals higher preload. Question number 3. Which factor directly increases afterload? Decreased systemic vascular resistance, increased aortic pressure, increased venous return, increased heart rate. The correct answer is option B, increased aortic pressure. Afterload is the resistance the left ventricle must overcome to eject blood. Question number 4. Which variable best describes the force of ventricular contraction independent of preload and afterload? Heart rate, contractility, venous return, systemic vascular resistance. The correct answer is option B, contractility. It is the intrinsic strength of the myocardium, often increased by sympathetic stimulation. Question number 5. Which nervous system branch slows the heart rate? Sympathetic, parasympathetic, somatic, enteric. The correct answer is option B, parasympathetic or vagus nerve. Parasympathetic activation releases acetylcholine to reduce SA node firing. Question number 6. Which phase of the cardiac cycle has the lowest ventricular volume? In diastole, in systole, rapid failing phase, isovolumetry contraction. The correct answer is option B, end systole. After contraction, the ventricle contains the least blood, called end systole volume. Question number 7. What does Starling's law state? Increased heart rate increases contractility, increased ventricular failing increases stroke volume, increased afterload decreases heart rate, increased venous pressure decreases preload. The correct answer is option B. Increased ventricular failing increases stroke volume. More stretch of myocardial fibers leads to strong contraction. Question number 8. Which hormone primarily raises blood pressure by increasing blood volume? Epinephrine, aldosterone, insulin, thyroxine. The correct answer is option B, aldosterone. It promotes sodium and water retention, increasing circulating volume. Question number 9. Which baroreceptor reflex response occurs if blood pressure suddenly falls? Decreased heart rate and vasodilation, increased heart rate and vasoconstriction, decreased contractility and vasoconstriction, increased heart rate and vasodilation. The correct answer is option B, increased heart rate and vasoconstriction. Baroreceptors trigger sympathetic activation to maintain pressure. Question number 10. Which parameter best reflects the left ventricle after load? Central venous pressure, systemic vascular resistance, stroke volume, ejection fraction. The correct answer is option B, systemic vascular resistance. Higher SVR equals higher afterload for the left ventricle.